Hi, everybody. Good evening. Thank you so much for joining me tonight on YouTube Live. I'm Dr. Howard Elkin, the medical advocate. And tonight we're going to continue on our journey to becoming our best medical advocate. If you remember from our last session 2 weeks ago, we talked about the new year. We always want the new year to be the best year. And a lot of us agree that 2021 was a really lousy year, right? We want 2022 to be a better year, but we can't just hope and pray because it's just not going to happen, not on its own. So we have to really make plans, and that's what medical advocates do. And I get away from lofty goals like I want to quit smoking, I want to start exercising, I want to lose weight. These are really lofty goals, and they're not really well defined. So we talked about honing in on your goals and making an action plan to meet these goals. And that's what we do as medical advocates. And we talked about, I gave you 10 tips, wellness tips that I personally use for my own wellness, and they work quite well for me. And you may have your own, but it's all about staying on track with your goals because we really want to make this a better year, and we can, but it's work. Now, tonight, we're going to go one step further and talk about metabolic health. And you might say, well, how important is metabolic health? Well, would you believe that only 12% of us, fortunately, I'm one of them, 12% of us are metabolically healthy? That means like 88% of adults in this country are metabolically unhealthy. So it's a major deal. Why? Because poor metabolic health basically equates to chronic diseases of diabetes, heart disease, and also stroke. So it's not so much a question of when, if it's a question of when. So it's really important. And it's very interesting. I looked this up, and on Google alone, there are 114 million hits on metabolic health. So people are interested in this topic for the right reasons. So what's the definition? Well, it means you have to have ideal levels of triglycerides, HDL cholesterol, which is a healthy cholesterol, blood pressure, um, uh, blood sugar, fasting blood sugar, and waist circumference. Now, I like this definition. I looked up this definition for a well-known biochemist. Get this: metabolic health is the absence of metabolic disease. Makes perfect sense, right? But we want to say that evolution actually selects those who are metabolically healthy to transcend one generation to another. So it's like survival of the fittest. It's evolution, and it really depends on metabolic health. So, what is metabolism? Metabolism is the chemical processes in our body that do everything, whether it's eating, shaving, working out, studying, watching TV. Everything we do, every action we do, sleeping, is a metabolic process. It involves metabolism, and that boils down to converting food to energy. That's it. Food to energy. That's our purpose. That's our purpose in life. So metabolic health describes how well we generate and process energy. Now, diabetes is an exemplar of poor metabolic health, no question about it. Now, if you recall from one of our sessions, maybe a couple of months back, diabetes affects over 10% of the adult American population. 10%. That's like 30 million, because I think there's 332 million people in the United States. 30 million. Okay. Now, guess this. That's 1 in 10, right? They suspect that in 5 years, 2000, actually 3 years now, 2025, it'll be 1 in 5. We're going to go from 1 to 10 to 1 in 5 in just a matter of 3 years. This is really pretty significant, and it's bad news. Now, you got to know also that 88 million people in this country have prediabetes. And get this, only 84 million of these people don't know they even have it. So they're not being tested. We'll get into that in a minute. So, but I want to be clear about one thing. You don't have to be a diabetic. You don't have to even be overweight to have poor metabolic health. Now, so what are the features of metabolic health, or I should say, poor metabolic health? So we look at waist circumference. If it's greater than 40 in a man and greater than 35 in a female, that's increased abdominal girth. That's abdominal obesity, and that is clearly a feature of poor metabolic health. Triglycerides 150 or greater. These are fasting levels. HDL cholesterol, which is a healthy cholesterol, less than 50 in a woman and less than 40 in a male. Systolic blood pressure, 130 over 80. Anything greater than that is hypertension. Now, I want you to keep in mind, this has changed over the years. Like when I was a student, many years ago, 140 over 90 was considered borderline. We didn't do anything about it. Now it's changed. So if it's 131 over 81, you're hypertensive. And something needs to be done about it because it's been shown in subsequent years that will lead to heart disease and stroke. And then fasting glucose of 100 or greater. Those are the 5 major features of metabolic syndrome and or poor metabolic health. So what you want to be is if you want to have ideal metabolic health, you have to have an ideal waist measurement. And you can't be pre-diabetic or diabetic. You have to have normal blood pressure. You have to have normal blood fats, triglycerides, and HDL. And guess what? You can't be on medications. That's how they define metabolic health, optimal metabolic health. Now, of course, a lot of people are on medication. So we still try to generate the best metabolic health we can, but they are medication. So that's just something that you keep in mind when they define this 12% versus 88%. Glucose is our major source of energy for most of us, and how we utilize it kind of depends. It kind of shapes how we're going to be metabolically. So it's really making choices in our diet and to keep the glucose really relatively well regulated. So poor metabolic health, what are the results? What are the sequelae? Well, worse brain function, worse memory, bad moods, skin health is not optimal, fertility problems, and risk for chronic disease. And again, diabetes, heart disease, and cancer are the most significant. Cancer, but also a stroke. Benefits of good metabolic health is sustained energy, a better memory, better fertility, better exercise endurance, improved sexual health, a stronger immune system, which is really important. People need to know that a metabolic profile that's favorable is going to segue into your immune system, which is really important with this era of COVID. And I've been telling people for months, since the beginning of this pandemic, almost 2 years ago, that if you want to be healthy and to protect yourselves, it's all about metabolic health and immune health. That's it. Okay, so what can you do about it? That's the important thing. Now you know the basics. First of all, you got to know the certain results, and all medical advocates need to know the results. You need to know your blood pressure. It's amazing how many people don't know their blood pressure. And by the way, a lot of your doctors will say, "Oh, 140 over 80, that's not 40. It's okay." Doctors see so many patients, especially the ones that aren't into functional medicine and HMOs and very large corporate medical practices. They don't really have the time to educate about lifestyle. So they'll say blood pressure 142 over 84. It's okay, but it's not okay. Not if you want optimal metabolic health. So that's important, knowing your blood pressure, knowing your basic lipid panel. Now the doctors will order that. Your triglycerides, it should be great. It should be less than 150. HDL, we talked about whether it should be 40 or 50, depending on your sex, your gender. But we're going to go beyond, and your fasting blood sugar, which should be less than 100. But I want you to know a few other markers that are very, very important. First of all, everybody should know their hemoglobin A1c. That's a marker on the red blood cell. Now, red blood cells last 90 days, which means this marker is good for 90 days. So what we do today will be reflected on the next test I do 3 months from now. That's why I don't do hemoglobin A1Cs more often than 90 days. So it's a very good measurement. So as a doctor, so I can see where are we going. And I want my patients to be as low as possible. So let me define it for you, because you need to know these numbers. Normal is less than 5.7. Pre-diabetic is 5.8 to 6.4. Anything greater than 6.4 is a frank diabetic. Now, I will tell you, not that I'm so great or anything, but I am more strict than a lot of endocrinologists. I have some of my patients, especially people that are on insulin, their A1Cs are like 7.8, 8.2. And I say, what does your endocrinologist say? They say it's okay, it's good. It's like, are you serious? It's not good. I want my levels to be as low as possible to obviate the complications of diabetes and also to make you more metabolically healthy. Okay. So I will do my best to get a pre-diabetic into the non-diabetic range. It doesn't mean we can reverse or cure the disease. We can't. It's not curable. We can treat it and we can keep you in a normal range if you work at it. So you want to know your hemoglobin A1c. You should know your fasting insulin number, your insulin level, because that really tells us do you have any insulin resistance, which is a major problem in metabolic syndrome and also in diabetes, type 2 diabetes. So what happens is that because our diet is not suboptimal and our exercise is nil to little, what happens is that your body doesn't recognize your own insulin, or it doesn't process it well. So what happens? Your body makes more insulin because it sees that it's not working. So the pancreas makes more and more and more, which is not good because insulin is also a fat storage hormone. So you actually store fat. And also, it's not great for the heart. So you should know your A1c. You should know your fasting insulin number. There's one of the tests that I do with my patients that's called a C peptide, C-peptide, PEBTIDE. That tells me if your pancreas is working overtime. And I kid you not, I have had patients with normal A1c. Their insulin levels are maybe slightly elevated, and they have a high C-peptide, which tells me their body is working very efficiently, but overtime, so that pancreas is churning out that insulin. It's doing its best to not make you diabetic. But as I said before, it's not a question of if, it's a question of when. Those are the tests you really need to know as a medical advocate. And some of your doctors, well, most of your doctors won't order them. They don't know about insulin levels or C-peptide or A1C. Most of them know, but do they do it? If you wait for your blood sugar to be high, you're already going to be a pre-diabetic, because almost every adult over the age of 50, I kid you not, it's going to have a fasting blood sugar over 100. I can't give you the exact number, but it's huge. So guess what? If your doctor doesn't do anything about it, like if I see an insulin level, if I see a fasting blood sugar over 100, I'm going to order a fasting insulin level. I want to know if this patient does have an element of insulin resistance, because again, that's going to lead to metabolic syndrome and eventually diabetes. I'm not going to wait till they become frankly diabetic, but that's what happens. That's what happens. Remember, 80 million people of the 88 million have prediabetes, and they don't know it because it's not being tested. Okay, so how can we improve your situation? First of all, it's your diet. Now, I created this. I don't know if you can see this, guys, but I created this a few years ago, and it's basically a listing of carbs. It's not a diet, but I don't count calories. I don't count grams, but I look at the glycemic index of food. Okay, so every carb has a numerical value. So I want it to be definitely on the lower side. So, like, let me give you an example. Sugar is 100. That's about as high as you can get. Baked potato, 90. So if you like baked potatoes, you're basically eating sugar. Pasta, bread, all these are very high. You know that. Anything white is what you need to avoid. But even things like sweet potato, which are complex carbs, oatmeal, they still break down to carbs. So you really need to limit your carbs to help regulate your blood sugar, which helps keep you metabolically healthy. So it's good to really know the most common carbs. I tell patients when I give this out, stick this on your refrigerator. It's not a diet, but it should be a guide. So when you do your shopping, you'll see that, okay, well, I like fruit. What can I eat? Well, the melons are really high in sugar, even though they could be healthy in nutrients. But berries and cherries are very healthy and low glycemic. Great fruit. So there are choices, and I want people to know, as they become their medical advocate, what choices are the best choices to help keep my blood sugar down and my insulin levels stable. Consistent exercise is really important. And it doesn't matter what's the best exercise for metabolic health. It doesn't really matter. Exercise is exercise. Now, those of you know that I'm a bodybuilder, and I believe strength training is really essential as we get older. That's probably the only guaranteed fountain of youth we have. But there have been studies, and I actually looked up these studies, and there was, like, if I can find this one, there was a meta-analysis, get this, of 10 studies, 16 randomized controlled studies, and they found that aerobic exercise was good, the combined exercise was better, and guess what? They didn't do anything with resistance training. It's just amazing that so little was known when these studies came out about resistance training. But then I went further and found the Cooper Aerobic Center in Dallas, which is a very well-known place. I actually spent a few days here many years ago to see how they operate. And they had 7,400 subjects, and they found that resistance training alone, twice a week, just bare minimum, right, reduced your risk of metabolic syndrome by 17%. And combining that with aerobic was up to 25%. And if you did resistance training just once a week on its own, you still had over 20% reduction in ability to go into metabolic syndrome. So it's pretty clear. that there's a lot of things we can do to prevent this from happening. Um, Other things, quality sleep. Okay, I'm really working on that myself now. Quality sleep is really important for metabolic health and also immune health. Okay, and managing stress. It's a pretty stressful times we're living in. Also, adding nutrients and supplements. We can talk about that in the Q&A if you're interested. And avoiding environmental toxins. Well, that's really hard to do. So anyway, so that's the basis of metabolic syndrome and metabolic health, and why it's so important that we cross that bridge from metabolic unhealthy to metabolic health. And as medical advocates, that's what your goal is. Because if you're metabolically healthy, you're going to be healthy. So now open the Q&As. I see a bunch here, so I got to get my glasses on. So give me 1 second here. Thank you so much. Okay. Let me go to these questions. Okay. Let me see. Is oat milk bad for A1c? Oat milk is probably better than regular milk because people think low fat milk, non fat milk. Milk is milk, and milk still has sugar in it. It's got lactose, which is milk sugar, and it's. I'm not a great fan of dairy, so but I think oat milk is probably a better choice. Okay. I don't know. I have to, since I'm not a big milk person. I don't really drink oat milk, so I have to look that up. But I would say it's much better than regular milk. Okay. I never understood why they don't have insulin on the CBC. Okay, on the metabolic panel. But you know what? Because it costs money. It's that simple. Your insurance doesn't want you to know your insulin number or your A1C. It's not part of the panel. Your doctor has to literally order your hemoglobin A1C, and they have to order fasting insulin. It's not part of the regular panel. I know it should be, and I'm a firm believer in that, but it's not. Okay, I had metabolic syndrome before, but didn't have a waist circumference over 40, but I did have visceral fat. Okay, thin on the outside and fat on the inside. How would one measure that? There are ways of measuring that. First of all, you get a Dexa scan, which is we use that mostly for bones, for bone density, but it also gives us a good idea of what's happening at the fat level. So, I mean, for example, China has a very high incidence of metabolic syndrome and diabetes. And they're not all obese, okay? They tend to be thinner than we are in this country. But, rice is a big staple in the Asian diet. And rice is like eating sugar. It's way up there in the glycemic level, so glycemic scale. So it's a great question, Eric. Thank you for asking that. But yeah, you can have a normal waist circumference. But if you really want to know about visceral fat, you can do a Dexa scan, and that would definitely be helpful there. Okay. Right. Is NAFLD, which is non-alcoholic fatty liver disease, associated with metabolic dysfunction? Absolutely. Absolutely. I rarely see non-alcoholic fatty liver disease, which is clearly now the most common form of liver disease that we're seeing, and probably the most common cause or common need for liver transplant. That's how this is out of hand. It's all related to metabolic dysfunction. Yes. Because what's happening is that the liver gets overloaded with, especially if you have something called fructose. Fructose is fruit sugar. So we have to be a little picky about how much fruit we eat. Okay. But the worst offender is high fructose corn syrup, which I know most of you know it's in anything that's commercial, sugary drinks, boxes, but any processed food is usually high and high fructose corn syrup. The liver does not handle that well at all. So what it does, it tries to throw out in the circulation fats that will basically become triglycerides, and it retains what it has to in the liver as fat. So it's basically really poor diet choices, and it's usually overweight people. So yes, it's definitely association. Thank you so much. Okay. Let's see. Jonathan said he does the use of, but then I don't have anything else. Let me see. Okay, let me see. Hold on 1 second as I scroll upward. Okay. All right. Such small screen. I got to look at my glasses. Okay, Jonathan. Do I use medications to get metabolic markers and range considered to be outside the spectrum? Okay. Do I take? Okay. First of all, when they mean medications, first of all, I'm not against medications when they're needed. Okay. And I see these posts on Instagram. They drive me crazy. It's like usually these people are not medical doctors, and they're quick to point out that all we do in medicine is pass out meds and do procedures. And it really aggravates me because I'm not that kind of doctor. Yes, I use medications. Yes, I do procedures. I like to think that I do it with circumspect, that I actually do it out of reason, of thinking. So I'm not into doctor bashing. I mean, I think as a doctor, the ability to transcend, to go from standard traditional medicine to outside the box thinking is a feather in my cap. So medications, if needed, if you need thyroid medication, you need thyroid medication. So I'm not against using it at all. And other part of your question, let me see if I get this straight now. Um, and even if you are on medications for metabolic syndrome, that's okay. I mean, I was just defining what these people, what's classified as healthy, metabolic health and poor health. So when I say 12% of the population, that means we're on no medications to preserve metabolic health. Okay. It doesn't mean we're on no medication at all. So it's because you shouldn't be on medication for hypertension or diabetes or metabolic syndrome. But that said, there are also a lot of supplements that we didn't discuss that can help with improving your insulin sensitivity. So I have my own product called GlucoWise Plus for HeartWise. And what we do with that, it's one component is alpha lipoic acid, which is a great supplement. It actually helps to recycle your antioxidants, and it helps improve insulin sensitivity. See, most people that become insulin resistant, that leads to this metabolic issue. We want everybody to go from insulin resistance to insulin sensitivity. So alpha lipoic acid helps. Chromium, I'm sure of chromium is a trace mineral that can help. Vanadium is another mineral that can help, and also cinnamon. So I use this with some B vitamins and other things to help improve insulin sensitivity, and it can work quite well. There are other things that you can use. So don't negate the use of supplements. Okay, let's see. These are great questions. Let me see. Yeah, I'm going to scroll this down. I need to have an assistant here. Okay, okay. Will metabolic syndrome lead to a lower kidney GFR and eventually kidney failure? It's really not. Yeah. Well, here's the thing. You got to remember that diabetes in itself can lead to kidney failure. In fact, it's the most common cause for people being on dialysis today. So that and hypertension, but I think diabetes is definitely the top of the list right now. So if it's uncontrolled, yes. And like I said, metabolic syndrome is really a precursor to frank diabetes. Like it's going to eventually develop frank diabetes if we don't do something about it, and non-alcoholic fatty liver disease. So no, it doesn't necessarily mean you're going to go into kidney failure, but it does mean we have to be really careful because we don't want to go to that point. We don't want to become diabetic. Is endothelium part of the metabolic diet? Endothelium, as you know, those of you that know me, I'm very much into endothelial health. Endothelium is that one layer of cell that lines all your arteries, big, small, and medium size. And as long as that endothelium is intact, I don't care what your cholesterol is, nothing's going to happen. But through smoking, hypertension, the environmental pollutants, stress, lack of sleep, um, hypertension, there's breaks in that one cell layer, and that allows for oxidized LDL to go in there and form plaque. And I forgot what your question is now. So is it part of metabolic health? Yeah, because I think in a strange way, I mean, it's not part of those five components. It's really those five measures that I mentioned that we talk about endothelium, but it's all a continuum, you see, because these problems will lead to heart disease. High insulin in itself is a precursor to heart problems and diabetes. So it's not what we're looking at right now. We're going to have a separate section on that in the future. Okay, let's see. Okay, here's a good one. Why is it that weight becomes such a marker of metabolic syndrome? I'm extremely thin and yet metabolically unhealthy. You're a perfect example of why you don't have to be overweight. Um, it's so we. It's just that. It's just that. That's a great question. The majority of people tend to be overweight, and obesity is very common. Okay, but you don't have to be. That's what I'm saying. You don't have to be overweight. You don't have to be diabetic to be metabolically unhealthy. So we treat you as individuals, and so just keep in mind that it does happen to thin people. Like I said, a lot of people in Asia are not overweight either, and they have a high incidence of diabetes and poor metabolic health. So There's no simple rule here. That's why I don't care how much you weigh. I don't care what your waist circumference is. We need to know those numbers. We need to know your blood pressure. We need to know where you are with your A1c. We need to know your insulin level, and that'll tell me if you're insulin resistant. Those are really important to know. So, regardless of your body size. Okay. Okay. Well, I talked about my major supplements, and again, the important ones are alcoholic acid, vanadium, chromium. There's other things as well, but make no mistake about it, diet and exercise are still the most important ways of dealing with metabolic syndrome and keeping yourself metabolically healthy. Okay, there's no question about it. The first thing I do with people that are obese or in poor metabolic health, if they really want to get metabolically healthy, I mean, some people will not do the work. They're just not going to do the work. Until I'm blue in the face, it's not going to happen. But if they're interested, I go over this list with them. And I say, these, you need anything in red, if you can see these, anything in red is what you need to avoid. Bagels, I mean, Cheerios, cream of wheat, pita bread, couscous, grape nuts. I mean, it's starch. Any of that needs to be really, not so much eliminated, but really minimized. Okay, so it's diet is the most important thing. Then I add supplements. And I've been able to really keep a lot of people off of medication, but sometimes you need it. Okay. How do you feel that inflammation and C-reactive protein fit into metabolic health? And how would you lower that marker? Good question. So what Jonathan's asking here is the inflammation part. And that's going to be another topic, okay? Because like I said, inflammation, metabolic health, immune health, to me, they're a continuum. You can't like do one without the other to be optimally healthy, to be your own medical advocate. So C-reactive protein is a very non-specific marker for inflammation. When I see someone, and again, you need to ask it. Your average doctor is not going to order a CRP. They're not going to do it. So you don't know if you have inflammation or not. You can feel perfectly normal. I have patients that I do it every time. If I see that they're persistently greater than one, I'm going to do a couple of things. I'm going to first ask about their oral health. And by the way, I don't trust most dentists. I'll tell you why. A lot of dentists are not really equipped to deal with deep pockets. I had a patient that I sent to a periodontist. He had pockets that measured 6 millimeters deep. Okay, that's a deep pocket that was missed by his dentist. And those are the pockets where food enters, and you have an inflammatory response. And probably the most common cause of elevated CRP is poor oral health. So it's very important. In my book that I've written, that'll be coming out soon, I have a whole section on this. I mean, I may be the only cardiologist that sends patients to a periodontist, and I'm proud of it because I have found a lot of disease that you don't have to have bleeding. You don't have to have pain. The other one is a gut. So I'm very fortunate to have an excellent nutritionist on staff, and her specialty is the gut. I mean, I might kind of specialize in cardiometabolic, but the gut is so important. We've talked about that before. If your gut's not healthy, you're not healthy. Major source of inflammation. So, Jonathan, they're all connected. And lower again. So it's what I try to do is really find the source of the inflammation. So I will send people to a periodontist. I will do a stool sample, and we can check and see how their immune system is functioning. So there's a lot of information we can get. These are not standard tests that your average traditional doctor is going to do. These are kind of limited to what we do in functional medicine. When's my book coming out? Well, in the next month or so, we're going to be doing a pre-launch, and all of you will be aware of that. I've never done a book before, so I don't really know the whole process. I'm just learning about it, so it's pretty exciting. But I won't. You'll be hearing about it, but it will be hopefully the first quarter of this year. But thank you. Let's see. I think I might make sure I answer these questions. Can someone avoid metabolic syndrome through fasting along and not cutting carbs? Fasting alone. Okay. I wouldn't suggest it. I am a believer of fasting. I've been doing intermittent fasting for over 3 years now. That's 3 years in February. And it works very well for me. It stabilizes my moods. It's really, my blood sugar is very stable most of the time. So, but would I not cut carbs? No, I wouldn't. I think it's like a yin and a yang here. Okay. So you're trying to do something good here, and you're eating what carbs. I don't think you'd be wholly successful. It may be a temporary hold, but I just keep a low carb diet all the time. I try not to have any starch after like 3 p.m. That's me. So my dinner is going to be protein, like fish, meat, to poultry, something like that, and vegetables. I usually like to have two kinds of vegetables. And I try to avoid, I mean, if I go out, it's different, but I don't usually go out that much. So I really try to avoid the carbs at night, which also helps your metabolism, by the way. Your metabolism is by nature, if you look at there's a circadian clock, it's higher during the day. So if you're going to have carbs at all, make it your breakfast and an early lunch, and avoid it at night when your metabolism is slower. Okay, I think we did it all, guys. This has been great questions. I'm so happy that all of you came, and we'll go again in 2 weeks. February is Heart Month, so I'm not quite sure what I'm going to come up with yet, but it'll be good. So it's Heart Month, so it's really special. So thank you so much for coming. I'm very grateful, and please spread the word because we need more subscribers. Helps my ratings, and it also you'll get alerts whenever we have a program, and we'll go from there. And if you view one of my videos when it's not live, if you could just click that little like button, that also helps. Thank you, guys. We'll see you in 2 weeks. Thank you so much.